Hey, my dear friends, you're welcome, dear listeners, and our friends around the world, in Nigeria and around the world. This is Vital Health International, a health conversation to help you eat healthy, live healthy, and feel healthy, and spend less money on doctors, on hospital fees, and on medical bills. It is my desire and our desire as we go on to help you live out your life on earth as God planned for you to live out. That's why this health conversation is coming your way. And I do hope that by the end of this program and in the subsequent weeks, you will learn a lot. We're going to go back to that walking, because that's one of the questions I get asked all the time when I speak to people. Recently, I was talking to some men, and they were asking me, I don't like to exercise. That's what some of them were saying. I'm too busy. I don't have time to exercise. Now, remember, we're talking about lifestyle modification, because getting medicated for some of these conditions is good. But there are some things you can control by your lifestyle. Now, when you talk about just walking, I know the Surgeon General says, and WHO regulations and stipulations says, 30 minutes a day, 5 days a week, 150 minutes of exercise in a week. Okay, yes. So or 275 hours in a week. So I want you to give it to me in practical terms. I work in the office, let's say as a banker, and I have to get to the office very early. So what does that brisk walking mean for me?
Okay. So currently my own lifestyle is not the greatest.
Okay.
I wake up very early. I wake up early to join a prayer group. So I realized that I can do two things. I can speak in tongues and I can walk on the treadmill.
Okay.
That works for me.
Okay.
So I can do that for 30 minutes, and 30 minutes I can do other things. I can get ready for my day.
Okay.
That adds up. I can do this 5 days a week.
Okay.
And at the end of the day, I can decide, oh, it's been a stressful day, I would do yoga. You can do yoga as well. I love yoga because it's stretching, it's toning, and it's exercise.
What's yoga?
Yoga is a form of exercise.
Okay.
You've not heard of yoga?
I've heard of yoga, but when I hear yoga, I think of Eastern mysticism.
No. Yoga is great. It is great. So it helps. It helps with muscle tone.
Muscle
it
tone,
helps
yes.
with firming up your muscles.
Uh-huh.
It helps with balance a lot.
Okay.
A lot of balance. As we grow older, balance is one of the things we have to
Yeah,
care and
I've
think
seen
about.
myself sometimes when I walk, I
Yes.
tend to want to,
Yes.
miss my balance.
Yes, and then things like joint diseases.
Yes.
Yoga helps with building muscles, especially even in osteoporosis.
How? Because I used to think of yoga like incantation, like
No,
cantation. You just sit down, chuku, chuku, chuku,
No,
chuku,
there are
chuku, chuku, chuku.
different types of yoga. Maybe you're talking about the meditative one, but there's
Okay.
the power yoga where you actually sweat a lot.
So what do you do in those power yogas?
Something as simple as doing like there are different poses.
Okay.
They have different names. Sustaining a position for duration, controlling your breath while the position is sustained.
Whoa.
So you're intentional about the position you're holding. And at times the positions are things that will challenge your muscles. Like if you had to do the warrior 1, 2, 3. So those different
But
positions.
you're not chanting incantation.
No, you're not chanting. You're just staying there doing your thing and holding
I
your
used to
muscles
think that
against-
yoga was chanting incantation.
No. Yoga is great. I usually recommend it for a lot
you
of my
kidding me?
patients.
Dr. Tony, apart from being active, what about your diet?
Okay, so the diet plays a big role as
Yes.
well. Until you're diagnosed with a particular disease, I just say moderation. Even after diagnosis with a particular disease and you have to avoid some things, whatever you're eating, you still have to do it in moderation. Moderation is always the key to success. So for someone who has high blood pressure, we tell you to do a low salt diet.
Low salt diet.
Low salt diet.
Okay.
The easy way to know it is wherever salt goes, water goes. So if you have a lot of salt in you, you tend to retain more water. And if you have more water, more volume, that affects your blood pressure. That's how I usually would explain it to my patients.
No, take your time. Let's take that easy, please. Let's slow down.
Okay.
Where salt goes,
Water goes.
okay, and when water goes,
There's an increase in volume.
in volume, so there increased volume in
Yes,
your body.
yes.
And when that happens,
it would affect your blood,
Blood pressure, okay.
So it's a matter of physics.
Okay.
Yes.
Okay.
Yes, so that's how I explain it.
Okay.
It's a little more complicated than that,
yeah.
but that's the easy way to understand it.
Oh.
If I retain a lot of salt, then I retain a lot of water.
Okay.
If I retain a lot of water, that means my blood volume increases and my blood pressure
will
increases.
go up. Okay. Now there's something else. Now before we even get into reducing your salt content when you have high blood pressure, before you have high blood pressure, why do you want to increase the sodium you take with your food?
Increase or decrease?
Increase. Because some people, no. Well, because some people naturally, when they get their food, even before they taste it, what do? They get a salt shaker, and they sprinkle the thing with salt, right? And then a lot of the fast food again that they eat is high in sodium and all of that. So people like that. So it's important for them, in order to manage their blood pressure or not to get into that zone at all, to be controlling the amount of sodium they take from the outset.
Yes. So the trick is not stopping salt all of a sudden.
Yeah.
Then it becomes tasteless to you. You won't enjoy your diet.
Okay.
So it's to take a little bit at a time off.
Yes.
So you do not notice the difference. And when you eat something that is normal salted, you go, oh, this is too salty.
Yeah.
So if you would usually salt with 2 tablespoons, cut it down to 1.5.
Okay.
Over a period, get used to it. Then cut it down some more, some more, till you use just a pinch. So it's what you get used to over time.
Yeah.
That's what I would tell my patients to do.
Okay. So you see, this advice is good both for those who have already been diagnosed and for those who want to avoid it. And one way why you want to avoid it is because, for instance, if there's high blood pressure in your family, these are things you need to be proactive about from the outset. So if you're frying dodo, for instance, do you want to add salt? It does. If you're frying dodo, it doesn't need salt.
Without salt.
Yeah, right.
Eggs are delicious without salt.
But that one is not true.
No, I don't put salt in my eggs.
No, that
you
one.
Put your
I have to put a little salt. No, I have
put
to.
your Mrs. Dash. And
I have to put a little salt in my. I mean, just a little, not much.
Okay.
Because I'm an advocate for controlling your salt. But again, I mean, yeah, I know you'll say they are delicious without salt. I've not found that to be true. Okay, but you've got to minimize the salt you take. You fry dodo, don't put salt. Already, some of you who eat dry fish, you know that dry fish comes with a lot of sodium.
Yes.
Okay?
Yes.
And all the fast food, pizza, and all of this fast food, they come with a lot of sodium already. In fact, Dr. Toye, you won't believe it. I mean, many years ago, there was a study that was carried out, and this study was done when I was still in med school. A study was carried out where it was shown that Nigerians take 300% more salt every day than is necessary.
Oh, wow.
300% more sodium.
I can't believe that.
So you understand why? Yeah. You know, some people, when they drink Gary, they put sugar and salt.
Huh? How would you put salt in Gary?
For some people, that's how it is.
Okay.
They put sugar and salt. You know, they put salt in everything.
That's
they fry yam.
That's unnecessary.
They fry yam, they put salt. They fry fish, they put salt. Everything, they put salt. So not surprising that they take 300% more sodium than. And of course, with the westernization, where more people now eat in restaurants where the sodium content is high in order to preserve the food. So this salt is
salt makes it sweeter, but you think about your health when you're making decisions.
That's very, very important. So some people use their mouth to kill themselves, right?
Yeah.
So you've got to be careful about that.
Yes.
Okay. Now, so we've talked about exercise, activity.
Yes.
We've talked about your food, sodium in particular.
Yes.
What else in terms of food-wise can help somebody with their blood pressure?
So, not just blood pressure, but things that would contribute to increasing the risk for heart disease, or what we'll say cardiovascular disease.
Okay.
So maybe something like the cholesterol, the amount of cholesterol in your food.
Okay.
So we've talked about the salt, doing it in moderation. Now we're talking about high cholesterol on the food, because one risk is high blood pressure, another risk is high cholesterol. 1 + 1 makes 2. So that means increasing your risk of
you've doubled your risk already.
Atherosclerosis. So you want to try to reduce the fat to, so you're looking at what you're eating. A lot of people would say, oh, fry with butter and non-margarine. You don't need to fry with butter at all.
Okay.
There are things like bacon.
Okay.
I hardly fry things in my kitchen.
Okay.
I would bake my meats.
Okay. Do you use air fryer?
I do use air fryer, but I still tend to just put everything in the oven and bake it.
Okay.
My chicken, my beef, whatever I'm doing. But when we're talking about lowering your cholesterol. You heard me mention beef. Beef is not something you eat all the time.
That's correct.
It's a red meat.
I mean, even though that's not good news for some of us.
Yes, yes. Beef is delicious. It's a red meat, but red meat is shown to have a lot of unhealthy fat.
That's right.
So you want to do whites. What are your whites? They're your fish, they're your turkey, they're your chicken. If
What
you
about goat
season it
meat?
right, it's red meat.
Are you kidding me?
It's red meat.
Oh
too,
gosh, I
It's
used to
red
think
meat,
that
Dr.
good meat.
Joe,
I
is
was
really
praying that good meat would not be red meat.
even lamb, lamb. So you can say nobody tells you not to eat it, but
Yeah.
you don't eat it every day.
Okay.
Okay. If you used to eat it once a week, maybe make it once in 2-3 weeks.
Huh? Good meat once in 3 weeks.
I hardly eat goat meat in my house, but that's preferential. But if you're talking about beef,
Yes.
you can make it once in 2 weeks, once in a month.
Yeah.
That is for someone who doesn't have a risk for
Factors,
arteriosclerosis
yes.
or risk for heart disease. If you do, then it's once in a blue moon when the blue moon
Who
comes,
comes out? Perhaps on Christmas Day. Eh?
Yes, yes, definitely. Or
Okay.
Thanksgiving or celebrations around. Yes.
Yeah. Okay. Now you've been throwing that word atherosclerosis. What's that? Is that a Greek word?
I don't think it's Greek. I think it comes from a Latin.
Latin. Yeah,
background.
it comes from Latin.
Yes. So arterial means blood vessel.
Uh-huh.
Arterial, arteries, blood vessels. Sclerosis means something. I would say aging. I would say it's not looking well. So
Well,
it's a disease of blood vessels.
yeah.
So the blood vessels are not healthy. A lot of things can cause it. But we've identified 2 things since we've been talking. We've talked about high blood pressure now, and now we've talked about cholesterol. So those
Yes.
things increase. And it's not just a blood vessel located in your heart, because there are no special vessels alone in your heart. It's blood vessel that gets everywhere
in
to the
your body,
brain,
yeah,
to
the
the
brain,
eyes,
yeah,
to the kidneys,
yeah.
so to the penis. So
Yes.
that's why I always tell my patients, if you're beginning to have erectile dysfunction,
Dysfunction.
it's a harbinger. You have to go and check on your heart.
That's right.
The same thing that causes diseases there causes diseases in the heart.
Yes, yeah, that's very interesting. Okay, so we're looking at conditions. You see some of the conditions that high blood pressure can cause. High blood pressure is such a disease that can affect the whole body essentially.
Yes.
Yeah, and it's one of the silent killers.
Yes.
Why is it called a silent killer?
Because oftentimes it's asymptomatic, meaning it doesn't have any symptoms.
Yes.
People walk around with blood pressure of 200 over 100 and something, and they don't know it. At times it's just a headache, and they say, oh, when I lie down, it's because of stress, it will go down.
Yeah,
And one day they don't just wake up,
Yep.
or they just fall down and they say, hey, they slumped and died.
yeah.
Slumping is not a disease, it's
Yeah.
a
Symptom.
symptom. It's something that's been happening and nobody knows.
Okay.
So at times people walk around with high blood pressure that's not diagnosed.
Yes.
See your doctors.
Yes, so that's very interesting. Now, because high blood pressure has been responsible for the sudden death of a lot of people.
Yes.
Because I hear some people, or this person, and then, not just apart from the sudden death, there's something, I know we're going to dedicate a substantial period of time to talk about strokes, because some of the people who have had strokes, they went to bed. I'm a Christian leader, and I have gone to meetings where I'm sitting down there on the stage and I'm seeing a lot of the Christian leaders, other Christian leaders who are walking by, they're limping. And I'm sitting down and I'm asking myself, why are they limping? I know why they're limping. Anyway, they've had strokes. And so you see that this thing is common, not just with Christian leaders, but with some people who are living a lifestyle of privilege, a lifestyle of opulence and all that. And it's a dangerous thing when you have stroke. You go to bed and then you wake up and one part of your body is not functional, or you cannot speak. Your face moves to one side, okay? Or some people just die. Because some of the people who have died sudden death, they died from unmanaged blood pressure that was not well managed. And what did they say? They're enemies.
Yes. Yes. Somebody called their names from the village. Though we may laugh at this, but it's not something trivial, though. It's to bring awareness that slumping or sudden death is not a disease. It's a symptom of something that's been happening.
Yeah.
If you do not know there's something happening in you, how can you fix it?
That's right.
So you need to know so that you can fix and you can take care of it. Yes.
So, so silent killers is just one of the silent killers because it's a disease condition that is there without symptoms. And sometimes the only symptoms you get are when complications have set in.
Yes.
And that is why, Dr. Toyin, they need to call your office. If you don't have a primary care physician, you don't have a doctor you talk to, you need to talk to Tell MD. You need to talk to Tell MD. Tell MD is coming to you in your homes. It's coming to you, you have it on your phone. You can carry it in your wallet. You can carry it in your pocket. I know ladies in particular, you have mirrors in your bags, in your handbags. You have your phone in your bags. You can call MD 24/7, any time of the day. Call Tell MD 0707 660 7330, 0707 660 7330. And you can send a message on Facebook, Tell MD, TELMD. You can send them a message, and on Instagram at TellMDNG, at TellMDNG. Guess what? Somebody will pick up your call. An appointment will be scheduled for you to speak with one of the doctors and examine in the comfort of your home, in the comfort of your office, in the privacy of your car. If you want to go out to the bush and do that where nobody will hear you except the birds and the animals walking around, you can do that, and they will attend to you in the privacy of your home, okay? This is a conversation, a health conversation of Vital Health. I'm your host, Dr. Joe Takon, and with me here today in the studio is Dr. Toyin, who is the Chief Executive Officer of Tell MD. My dear friend, this is medicine to you in the privacy of your home, and I want you to take advantage of this. Now, we've been talking about hypertension. Can it be managed with medications?
Yes.
Okay.
Definitely, yes. There are lots of medications that help manage. But when you see your doctor, they are going to look at, like I said, holistically, they're going to look at your whole. Are there other health issues?
Okay. That's assuming complications have not set in.
Have not set in.
Okay.
Or maybe other lifestyle diseases, since we talked about hypertension being a lifestyle disease. Is there something like diabetes? Maybe they will pick out a medication that will help with complications or help with not the diabetes, usually the other way around, but that would help with the kidneys or the effect of diabetes in the body, and yet control your blood pressure as well. So they look at you and they give you the appropriate medication for you. There are lots of medications to control blood pressure. There are lots of medications that are older than me. And a lot of people will say, oh, I had this side effect, so I stopped using the medication. No, that doesn't help you. Talk to your doctor. There's always something else. There are alternatives. Or, oh, I used it and I saw that my blood pressure became normal, so I stopped. No. We started by saying hypertension is a chronic thing. We can only manage it.
You can manage it, cure it, yes.
So if you can't cure it, you can't stop using your medications. So you use your medications to manage it daily. It's
interesting you've said that, because I have met patients who said, I stopped my medication because I was not in the hospital. That when I got discharged, it was not necessary for me to take my medication. Or, well, the symptoms stopped. So why should I continue taking my medication? Once you have high blood pressure, my friend, you're going to take your medication for a long, long time. And I tell you, some of you say that, well, I don't like taking medications. Listen, my friend, if you want to live your life and live a fulfilling life, and be useful to yourself, to your society, to your family, it's important for you to take this medication. It's not such a headache for you to live long, and it's important for you to take the medication. Now, what about Agbo to treat? Agbo.
So, a lot of medications are derived from Agbo.
That's right, from herbs.
But the issue I have with Agbo or herbs is that you don't know the complete constitution.
That's right.
You don't know how much of this is in it and how much of that. And even if you did, you don't know the amount of this that is toxic and the amount of this that is just enough. To cure. That is just enough to treat. So if you can bring out an Agbo that you know all the what constitutes it, and you can say, if you use 1 tablespoon, it's not toxic and it will work just right, then that Agbo is fantastic. But at that time, we'll start calling it a medication. It stops being Agbo.
It's been synthesized properly in the lab and by empirical means and giving us empirical results. That's when it stops being Agbo. That's when it becomes a useful medication. Now, we're going to go on break. But before we do that, I would like us to look at some of the other things that one can do when they have high blood pressure. Okay, you've talked about their diet, right? You've talked about their exercise. You've talked about medication. What about anger management? What about good sleep habits, right? What about, taking fruits? And so tell us.
Okay. So one of the issues and challenges we have these days is sleep.
Yes.
Sleep. And my friends and I joke and we tell ourselves that, we are, what do we call it? Insomniacs. We are people that do not sleep. But it's common that in our age, when we are striving to settle so that in our later years we have enough to take care of us, and at this point we have enough to take care of our children, we are staying awake, we are thinking and dreaming, and we are seeing visions. And also for some women who are perimenopausal, they might be having hot flashes, and some people it's just anxiety keeping them awake. But sleep plays a big role.
Yeah.
If you're not sleeping well, you're not going to be resting well, and then your blood pressure will go up. And also stress.
Yes.
Stress. So this is why I tell people, if you know you can't watch the news without getting angry or without getting sad, please read your news. Read your news. There are some people
Without
that
getting
are
worried.
okay. Yes, there are some people that are okay be watching the news and they watch it and they are fine. But if you know you're not one of those people, read your news and choose which information you want to put inside you so that you're not getting upset.
Yes.
When you get upset, your blood pressure goes up. And you say some people, they say, oh, he was so angry, and he just fell down and died. Probably had a stroke because his blood pressure was uncontrolled,
Yes.
and then he was stressed, he didn't sleep, and that happened. So sleep is very important. So
Yeah.
say for an adult, you should sleep at least 8 hours of uninterrupted sleep.
That's right.
God have mercy.
God have mercy. I get that prayer because you won't have 8 hours, right?
Yes, but you should practice good sleep hygiene.
If I actually read a study where they say that the man needs more sleep than the woman.
Who said that?
No, I read it. No, seriously, I read that study.
Who said
I'm
that?
serious.
The woman needs more sleep.
No, I read that study, and it's a true study. I'm telling you, I read that
Dr.
study.
Joe, you're going to forward
I'm
that
not- I'm
study
not-
to me.
I wish I can find. No, but I read that study where the
I
man
don't
needs
know.
about 8 hours of sleep and the woman needs about 7 hours of sleep. Seriously.
Well, if we look
out there.
at evolution though, and look at the position the woman holds, she has a lot to do. So she probably has been fashioned to not need as much as the man
Exactly,
does.
absolutely. So you know that now. So we men need to sleep a little bit more and don't disturb
I
the-
didn't say that, so don't quote me.
Oh boy. Okay, so we're going to go on break, and before we do that, I have to give you the phone number one more time: 0707 660 733 0707 660 7330. This is Vital Health International. I'm your host, Dr. Joe Takon. But hey, I am talking for Tell MD, and with me in the studio is Dr. Toyin. This is a program that will help you get appropriate diagnosis in the privacy of your room at any point in time. You can do it virtually. You can use your phone. You can use your computer. You can use the various platforms that allow you to access electronic media, and doctors there will attend to you. Very compassionate doctors, very intelligent doctors, and doctors who care about you and care about your pocket. They want to help you spend less money on medical bills and on hospital fees. So right in the privacy of your home, Tell MD will bring you good medical care and good follow-up care. My dear friend, Vital Health with Dr. Joe Takon. We're going to go on break. See you on the other side of the break.